This meeting is being recorded, and it will be made available after the event. Participants' microphones have been muted. If for some reason you become unmuted, please remute your microphone by either clicking the mute button or by using the keyboard shortcuts. For Windows, it's Alt plus A, and for Macs, it's Command plus Shift plus A. Again, pressing that once will probably unmute you if you're even allowed to, or and doing it again will remute you. Video is also off as you enter the meeting. If you turn on your video, we are asking that you turn it back off to ensure proper bandwidth can be maintained for the meeting. You can either click the turn off video button or use the keyboard shortcuts. The Windows, it's Alt plus V, and for Macs, it's Command plus Shift plus V. Keeping your video off will also ensure that ASL and card providers will have priority for the screens. Please use the chat feature to send a private message to Moss Lynch for questions related to accessibility for this meeting, while sending an open message should be limited to technical concerns related to this meeting. Chat will be monitored. To access chat, either click the chat icon or use the shortcut keys. In Windows, it's Alt-H, and that will display or hide in-meeting chat panels, while for Macs, it's Command Shift plus H. As I had said, ASL and CART captioning is being provided, so I would like to, I'm not sure if one of the interpreters would like to comment on that, how someone could pin the interpreter, but I will turn it over to the interpreters who would like to discuss that. Okay, so there is a pin option under the if you see where the people are, you can pin people, so it's prominent on your screen in the video portions of it. So with that, in the unlikely event this meeting has technical related issues that causes it to disconnect, please wait for an email with new instructions on how to reconnect. I'm not anticipating this is going to be an issue, but that email will be sent within 10 minutes of the disconnection. Again, I don't anticipate it being an issue, but I wanted to provide you this information for the just in case possibility. Live captions instructions have been placed in the group chat as well. And now with a little bit of the housekeeping out of the way, I have one last thing I would like to do, and I want to see if Mary Mahon McCauley has joined the call. I'm just trying to find her in this wonderful list so I can unmute her. And Mary, I'm not sure which number is associated to you, because I have a feeling you might have called in. So with that, I'm sorry, I will. If you can unmute, Mary, I don't know if you can unmute yourself. I'd like to turn over the first part as we start moving on to the presentation.
Hello, Jeff.
Oh, Mary, you are there. Perfect.
Yes.
Okay.
I just unmuted myself.
Okay, perfect. So with that, let me put the agenda up on the screen here. And so with that, I would like to start with our first presenter is Mary Mahon McCauley, as MOD's Executive Director. She will be discussing the introduction and MOD overview of services. Mary, please take it away.
Thank you, Jeff. Good morning, everyone. Welcome to the first MOD, Massachusetts Office on Disability, virtual presentation for ADA, Municipal ADA coordinators, commissions on disability, and executive directors of independent living centers. I'm really happy that people were able to join. I'm not sure what the count is. It will be interesting to see how many ended up calling in, and we still may have some people calling in a little late or joining us a little later. But let me start out by telling you a little bit about myself. Many of you have not met me, obviously. I am very new to the role of Executive Director at Mass Office on Disability, having begun the position in September of 2019. I've actually worked for the Commonwealth of Massachusetts since 1989, and through through last summer, 2019, and I was employed with the Massachusetts Rehabilitation Commission. At that agency, I worked as a vocational rehabilitation counselor, a unit supervisor, a job placement specialist, and an area director. I want to actually go back way back before 2019. I've been around for a while. I went to college at UMass Boston and received my bachelor's degree and master's of education in rehabilitation counseling. And I am an individual with disabilities. I am blind, and I've been legally blind since I was 17 years old. That was the time that I crossed over from visual impairment to legal blindness at age 17. And that was before Chapter 688, special education in high schools, and in the 70s. So I have been able to be a front row witness to a lot of changes. I was in high school, actually, with the Rehabilitation Act 1973. I was beginning high school, and, I've been able to watch through the Americans with Disabilities Act in 1990, and so it's truly an honor. I really feel humbled and honored to have this position as the executive director of MOD. It means a lot to me personally and professionally. When I began at UMass Boston many years ago in the 1970s, I had been, blind, as I said, for a couple of years, and had dealt with a vision problem, primary macular degeneration. I had dealt with that since age 9, but I was in complete denial of the fact that my vision acuity was decreasing. I didn't talk about it. I didn't let people know. I made believe I could see the blackboard at school. I made believe I could read the books, that I really couldn't see the print much anymore. And that denial lasted, through my childhood into my teens. What I like to add, and I think it's appropriate to add at this point, is I actually delved into heavy-duty substance abuse. So, another disability I have is I do have a substance use disorder, and I've been sober for over 30 years. So, I'm not saying that I had the substance use disorder due to the fact of the blindness, but I think that the denial of it especially kind of fueled the fire with the addiction and the alcoholism. So since my early 20s, I haven't had to drink or take mind-altering drugs, which is a big part of my entire recovery and rehabilitation through disabilities. I actually was in, as I said, very, very strong denial, and it was when I started University of Massachusetts at Boston and went into what was then called, I think it still is, the Lillian Sempler Ross Disability Service Center. That was when I came out of the closet as a blind person. And I believe, and that was back in 1975, that was when my life as an advocate began. And so I've had the opportunity to advocate on all types of cross-disability issues my whole entire adult life, and I've been involved with marches in Washington, D.C., and Boston, a lot of various activities that have all been promoting the rights and the access that people with disabilities need to keep everything as an equal playing field with others. So, through my career, as I said, at Mass Rehab Commission, my focus was employment for people with disabilities, which is, one of the best ways to really move forward in life. I mean, employment, it covers so many things other than just a fiscal advantage, the financial advantage. It's the self-esteem and the support and the, being able to be a contributor. And so that's been a major part of my career for 30 years. So coming into this position in September, I was not at all new to disability work or working with people with disabilities, but I was very new to Massachusetts Office on Disability. And I'm very, really proud to say that it's a great agency. And there's about 15 people. Hold on one second, please. Alexa, quiet. Someone give me a time check.
Yes, Mary.
Can you hear me?
Yep. Yes, Mary, you have about 3 minutes left.
Okay, thank you. I want to just go over that's enough about me, and I want to go over the agency and the different programs that we have. I didn't realize that the agency was made up of so many different programs, and it's really quite a long list. And for a small staff, we really give a lot of bang for the buck, I would say. So we're going to have someone talking in a little while about the Municipal ADA Improvement Grant Program. There's going to be someone speaking on the Emergency Preparedness Program, so I won't get into that as much. But we also offer all types of trainings. And although COVID-19 has, hit in March and the whole world is pretty different right now, we've still continued to provide all of our services and programs, everything but face-to-face training. We have a disability rights unit, and within that unit, the individuals answer telephone calls or emails about anything that's disability-related, questions on people's rights or any issues that are specific to disability. We have the Client Assistance Program, which is a program that works to advocate for and provide technical advice to consumers that work with vocational rehabilitation, either with Mass Rehab Commission or Mass Commission for the Blind, or with independent living centers. The various trainings, I've said that. We are on the Massachusetts Architectural Access Board, the 911 Commission, several boards and commissions with the agency. So we really do a lot. The part of, excuse me. What I was going to say is that the major change has happened, obviously, for all of us with COVID-19, and the office has become a remote workforce, and that's been since March. But as I said, we've continued to do and provide all the services that we need to. And I want to end. I've mentioned some of the services, a little bit about me, but I want to end and just have Charlene, if you could read the mission statement, and then we'll move on to the next speaker.
And Mary, can I ask, is Charlene, is she on the phone or is she?
Yes.
Yeah. Okay. So Charlene, I think you can unmute yourself. I think I'm just not seeing you. There's a lot of phone numbers, just basic phone numbers. So, sorry, I'm just trying to find. I don't know where
781.
Charlene. Well, Where do that? One. Yep. Okay. So let me unmute. All right. And Charlene, are you on? Charlene, are you on? Charlene.
Sorry
Okay.
about that. It was much simpler when I was on the phone with her. So
Yeah.
anyone can. At some point in time, we will read the mission statement.
Okay. I'm sorry, yeah, Mary. We'll do that in between the next one because I'll turn it over now to Evan, Evan George, and we'll get to the mission part. So if Charlene, if you can reach out to me to let me know what your number is, so we can undo that. But thank you, Mary, really for the brief overview. Now I'd like to turn the next section over to Evan George, and let me just get back there. To Evan George, he's MOD's Emergency Preparedness Training Coordinator, and he's going to discuss MOD's activities and COVID-19 related activities. So Evan, if you are there, you may start up whenever you feel comfortable.
Thank you so much, Jeff. And again, my name is Evan George. I'm the Emergency Preparedness Coordinator with the Office on Disability, and I also served as the Access and Functional Needs Officer for the Mema Mass Care Working Group. And I'll get to MOD's role in the COVID Mema response in just a second. But just to go back to what Mary was saying in terms of our operations, we, like many of you, had a very steep learning curve where it came to, I don't believe pre-COVID, we had a single employee that was working remotely or from home. And like many of you experienced, all of a sudden our entire office was told to go remote. So we certainly went through the same speed bumps as all of you. However, very happy to say that right now, we are fully operational. There are some slight changes that I'll get into for a second, but COVID has now not completely changed the way that we normally do business, and our service and turnaround time for responses has not changed, except for the fact, of course, like many of yours, all of our activities are now virtual. We are still attending COD meetings. We still conduct all of our other trainings except for one, and we are depending on the reopening guidelines, like many of you, in terms of when we will begin our transition back to the office. If you are still looking to contact CAP, if you have concerns about vocational rehabilitation services or any of the services that people receive from the independent living centers, please do continue to reach out to us. And also you should contact the Disability Rights Unit to discuss issues related to disability rights and employment, housing, government activities, places of public accommodation, education, etc. Some of the bigger changes is that some of our trainings that we normally conduct, such as our 2-day community access monitor program, which is generally held in person for 8 hours over the course of 2 days, is of course right now on pause, and that is being reworked so that we can still provide that training, that service, but to do it safely remotely. So now in terms of MOD's collaboration with Mema. As many of you are aware, Mema, the Massachusetts Emergency Management Agency, was activated very, very shortly after some of the earlier cases began springing up here in Massachusetts. MOD is part of a much larger contingent of teams for government services that was asked to send a few representatives to help with this response. That ended up being myself personally, along with Jeff and Mary. And really our role was to give access and functional needs guidance, particularly on 2 major programs that was being run by the state. One was the food distribution program. One of the early challenges that Mema foresaw was that vulnerable populations, people who are dependent on whether that be nonprofit, private services, government services, think in your mind, soup kitchens. Well, how are we going to establish food in a congregate area where we are asking people not to congregate? That was one of the logistical problems that MOD weighed in on, just to make sure that we had taken into account all of our citizens, regardless of access or accommodation. The second larger program that we helped design for the Commonwealth of Massachusetts was about the sheltering program. One of the other major roadblocks that we faced was what to do with somebody who tests positive for COVID, however, does not have a place to safely isolate or quarantine. So think in your minds, if there is somebody who faces domestic abuse at home, or if there is someone who is housing instability, who doesn't have a residence to go. So we, along with the larger mass care working group team, created a program where individuals, after they tested positive, can enter into what was a hotel station program. Along with that, we also made sure that all of these sites, also looking at some like the larger scale hospitals, the field hospitals that you may have been reading about in the papers, in case we ever had to do larger congregate shelters, making sure that those areas are still meeting all of the access and functional needs requirements. While COVID did throw a curveball in everyone's emergency plans, and I believe I'll be speaking to that in greater detail a little bit later in this program, that does not at all mean that we are now forgetting the ADA, that we are forgetting our most vulnerable citizens. And so it was really our responsibility to make sure that no matter what plan was designed, there was a focus on everyone. And outside of those two programs, as I mentioned before, MOD is back to running in its full remote capacity, and we are looking forward to additional guidance from the state of when we can return back into the office. And Jeff, back to you.
All right, thank you, Evan. And I'm sure that there's more to talk about when we get to a little later on. What I would like to do is, and I think if we are switching interpreters, let me make sure that, sorry, let me just, sorry, just, right, oh, maybe sorry. Sorry, I'm trying to get the interpreters. Oh, there we are. Let me just pin. Perfect. Okay, so thank you very much. And Charlene, are you there? Were you able to connect?
Yes, can you hear me?
Okay, yes, we can hear you. So I just wanted to circle back to, if you could just read out MOD's mission that Mary had alluded to, and then we will move on to the next section.
Yep, the Massachusetts Office on Disability works to ensure the full and equal participation of all people with disabilities in all aspects of life by working to advance legal rights, maximum opportunities, supportive services, accommodations, and accessibility in a manner that fosters dignity and self-determination.
All right, thank you, Charlene. I appreciate that. And as we can see, moving on to the next category will be for Carl Bryant. Carl, I just want to make sure that I can hear you first, so can you just say hello?
Yeah, hi, can you hear me?
Perfect. So Carl Bryant is MOD's grant compliance coordinator for the Municipal ADA Improvement Grant Program. He's going to provide an update on this program. So Carl, if you want to take it away.
Yeah, good morning, everybody. As Jeff said, my name is Carl Bryant, and I am the grant compliance coordinator at the Massachusetts Office on Disability. Specifically, I oversee the Municipal ADA Improvement Grant. Our office has been managing the ADA Improvement Grant program for the past 4 years, and we are happy to say that by working with state and local officials, this program has been able to contribute to many projects and plans that have removed barriers to accessibility across the state. Currently, we are in some of the final phases of the FY20 cycle. This cycle, like almost all previous cycles, the selection committee received hundreds of applications. Luckily, due to an increase in the amount of money available to award, the selection committee was able to select 50 grants for approval. This was almost double the amount of grants that the selection committee was able to approve as compared to last year, the FY19 cycle. Of the 50 grants the selection committee awarded, 26 were planning grants and 24 were project grants. Planning grants are grants awarded through this program, which are specifically for the creation of a self-evaluation and transition plan, which highlights areas of improvement in respect to accessibility, as well as an outline of what it will take to remedy said areas of improvement. Alternatively, project grants are meant for making capital improvements to municipal facilities, services, and programs, sometimes using the transition plan that I mentioned before. About $800,000 was awarded across the 26 selected planning grants, while more than $1.1 million was awarded across 24 project grants for a total of more than $1.9 million dispersed across the state for accessibility improvements. Some of the projects from this past cycle include the installation of accessible restrooms for an elementary school, a wheelchair lift for a town hall, accessible walkway to a beach, and the purchase of assisted listening devices, and much more. Moving forward, we anticipate that the application submission period for the FY21 cycle of the grant will begin on August 1st and will last until October 9th. Again, due to the ongoing situation relating to COVID-19, these dates are what we expect and anticipate. However, if anything changes, we will make sure that all relevant parties are informed. If you wish to apply, and I hope that you all do, then you will need to have meet a few prerequisites depending on which grant you are applying for. To apply for a planning grant, your city or town will need to have a posted non-discrimination policy, a published grievance procedure for residents, as well as a designated responsible employee for ADA-related issues. Project grants have the same prerequisites as well, as they need to have a completed self-evaluation and transition plan on file with our office. This information can be found on the brochure for this program, which we will be providing you with. Before you apply, we strongly recommend that you receive quotes for the price of what you are applying for, rather than making an educated guess. This will not only reassure the selection committee during the selection process, but it will also ensure that awardees receive all that they need to complete their projects. Also, keep in mind that there is a $250,000 limit per application. The higher your asking price is, the more competitive your application becomes. The selection committee seems to select one $250,000 application per year. Keeping those factors in mind, some applicants apply using different strategies. Some applicants make multiple applications for smaller projects with smaller asking prices in hopes of having a better chance of one or a few of their applications being selected, while others put all of their projects into one application with a higher asking price to try and get the kind of golden ticket, one $250,000 grant that the selection committee seems to be dispersing per year. Factors besides asking price that go into the decision made by the selection committee include whether a municipality is part of the community compact cabinet, which I think all communities are in Massachusetts, whether they selected the public accessibility best practices option in the application, which I can help you with when you apply. You can call me directly, and my information will be on the brochure, and we can help you with that as well. And whether or not a community has a duly established Commission on Disability and other things as well. If you need more information for this grant, you can visit our website at mass.gov/mod/ADA grant. This website is listed at the bottom of our grant brochure as well, and we will make sure to provide everyone with that. Thank you very much for listening to the summary of the Municipal ADA Improvement Grant, and thank you for your consideration as well. And I will hand off back to Jeff.
All right, thank you, Carl. And just so everybody knows, when we get to the resource slides towards the end of this training today, you will also see a direct link provided there to not only the Municipal ADA Improvement Grant Program, but as we switch to the next topic, the personal emergency preparedness trainings that we've been hosting, I want to turn it back over to Evan George. And you can provide an update on that particular program that we're running as well. So Evan. Evan, I wonder if you just make sure you're not muted. Let me make sure you're, there you go. All right.
Thank you very much, Jeff.
Yep.
And so as I mentioned earlier, I am the Emergency Preparedness Coordinator with MOD. What that means is that I manage our Emergency Preparedness Grant. And the history of this grant comes out of Hurricane Katrina. Back in 2005, Hurricane Katrina completely devastated the city of New Orleans and resulted in about 1,800 deaths. After that incident, the state and federal government conducted what's referred to as an after-action report. And one of the things they found was that almost half the people who died, so roughly 900 people, fell into one of two different categories. The first were senior citizens, and the second were people with disabilities, somebody who required an additional accommodation. And at first, this confused everyone in the room. They didn't understand why was the death count for these two populations so much higher than other demographics. And what they did was they took a look at New Orleans' emergency plan, and what they discovered is that really at no time did it take into account the unique needs that someone with a disability may have. So for example, if we send out a communication blast on the radio, but there is somebody who is deaf or hard of hearing, how do we ensure that they actually received that emergency alert? Or if we ask somebody to evacuate to a shelter, and that shelter is 20 miles away, and they might have mobility issues, or maybe they just don't own a vehicle, how do we actually ensure that our citizens are getting from where they are to the shelter? Again, believe it or not, before Hurricane Katrina, these really weren't the big picture questions that people were asking themselves. And so what MOD has been doing since 2007 has been putting on as many micro trainings as possible, specifically targeted towards vulnerable populations and people with disabilities. And what this looks like is a 1 hour long to 1 hour and a half program, depending on questions, really broken up into two different parts. The first part is about the governmental response. And I'm sure many of you have questions to the specifics, and I'll try not to monopolize the time. But looking at not just what is MOD's role in providing guidance and support for people with disabilities, but what are the state mechanisms for emergencies? And these look like things like the 911 disability indicator form, so that if somebody might require an additional accommodation or just might want to provide more information to a first responder in case of a 911 incident, the state system to get that information safely into the hands of your first responders, only to be used in emergency. Also in terms of communication, one thing for everyone who's been tracking Massachusetts COVID response is a program called 211, which is the Mema Hotline 24 hours a day, 7 days a week to answer questions during state level emergencies. And this phone number has also been activated to assist with the COVID response. And after sharing some of the more governmental programs we have, there is a nice app that your tax dollars have provided for us called Ping4 Inc., which provides GPS awareness of your location to only inform you if you are in the disaster area. Once going through the governmental overview and programs, it then heavily focuses on individual preparedness, making sure that everyone who is in the audience is really thinking about two different things. One is what information do we need to have written down, ready to go at a moment's notice? And the second is what materials. And really the big draw of the program, besides getting to listen to me talk for over an hour, is an emergency preparedness bag provided for everyone who meets the necessary requirements of need an additional accommodation. It's, I believe, close to a $60 value that is filled with a lot of the essentials in terms of first aid and disaster preparedness, items ranging from 2 to 3 person capacity for water that can be stretched over 3 days, a 4-in-1 hand crank, flashlight, radio, a cell phone charger, first aid kit, whistle, all types of communication and necessary equipment that people might need. Now, in terms of this emergency preparedness training, I have also been updating it to really meet everyone's primary concern right now, which is COVID. And sprinkled throughout this program is different updates about how to receive additional information about COVID, but also to really the awareness of it itself. And there's something that here in Massachusetts we've really strived to do, which has been very disciplined with our messaging in terms of what information do we share about COVID. And what I mean by that is I, like many of you, are listening to podcasts, reading the news, staying up on the international awareness treatment scope of this pandemic. However, the only information that we share will only come directly from the Department of Public Health here in Massachusetts. And that is really one of the most important things in any disaster is a streamline of communication. It's one of the reasons our governor, Charlie Baker, goes on TV in the same channel around the same time just about every day to create really a centralized distribution of all communication. So along with just updating the information around COVID, I have also ensured that we would have accommodations, because while this program would normally be done in person, we of course do not want to be congregating in large numbers, especially if it is a vulnerable population. And there's really two different options in terms of virtual accommodations at this time. One is that I have been conducting what I refer to as train the trainers. So this might just be a one-on-one conversation with me and you, so that you could then share the information I provide with your staff, with your clientele, in whatever capacity it is that you interact or engage with an individual who might have disabilities. The second is to have your clientele to be on the Zoom call with me, to go through the training, to ask questions in real time. And no matter what option, afterwards, I then will meet you or your staff at whatever destination here in Massachusetts you would like to drop off the emergency preparedness kits, and then you can disperse them at your own convenience in a manner that suits the needs of your organization. If this program sounds interesting, again, it is 100% free, and by that it is paid for by a grant through the Department of Homeland Security. The most effective way to schedule this training is actually just to reach out to me directly. So I'm going to drop my email in the chat, but it is evan.george@mass.gov. And we do space out some of the trainings. I am booked out at least until the end of this month. However, I am accepting new trainings for August. So please do not hesitate to reach out to me if you would like additional information, even if it is just around COVID, if you would like more information in terms of Massachusetts's disaster response during this incident, just because, as I mentioned before, I served as the Access and Functional Needs Coordinator for Mima during the Mass Care Working Group with this crisis. So I am happy to make myself available to either answer your questions, or if you have clientele that have additional questions, especially while the entire Commonwealth is really navigating these scary, difficult, and unfamiliar times. And with that, Jeff, I'll bring it back to you.
All right, thank you, Evan. What I want to just clarify here, that on the resources slide deck, you will also find a link to the Personal Emergency Preparedness Training Program. So you can find all the resources that Evan was discussing. You can also find a lot of the workbooks and how to get in touch with him as well, including his email. And again, there is also the link to the Municipal ADA Improvement Grant Program in the resource slide. So you can also then reach out to Carl or to me to answer any of those questions. So again, thank you, Evan, for that discussion. And I wanted to, I think we're on to the section where I want to introduce Moss Lynch, who's MOD's Assistant Director for Training and Communications, to discuss the upcoming 2020 MOD Disability Summit. And Moss, I will turn it over to you. I think I've unmuted you. And Mary, I know this is a two-parter, so Mary, I just wanted to verify that you are unmuted as well.
Yes, I am.
Okay, so Mary's unmuted, and Moss, are you unmuted?
Yes, thank you, Jeff.
Okay, thank you.
So good morning, everybody, and thank you for being here. My name is Moss Lynch. I'm the Assistant Director for Training and Communication for the Massachusetts Office on Disability. I'll give a quick overview on our two big upcoming virtual events, our summit and our ADA coordinator meeting, and I'll turn it over to Mary if there's any final comments to add. So we have hosted the annual Disability Summit for 5 years now for the Commonwealth of Massachusetts, and the focus of the summit is to bring about very important topics throughout the state and introduce the public to what's going on, and hosting networking events and tabling events for participants and attendees across the state. Many of you may have actually been at our event last year. Our event last year was focused on local communities and initiatives for municipal CODs and ADA coordinators, as well as all of the independent living centers and different resource organizations throughout towns and cities throughout Massachusetts. This year, unfortunately, our summit has to move online, but that doesn't stop us from continuing to promote these very important initiatives that we have. So as of now, we want to say to hold the date for October 2nd, 2020, and we will be hosting a virtual summit through our Zoom platform. And this year we had to change our topic from, we were talking about some recreational, accessible outdoor sports and different activities throughout the Commonwealth that are changing through technology and recreation. We've had to shift our topic a little more into the COVID-19 pandemic to focus a bit more on health and wellness, particularly those towards persons with disabilities in the field of healthcare, emergency preparedness, mental health, and wellness. So right now we are in the works of creating this summit agenda, but because things are changing every day, we're getting new information and topics are constantly changing. Our overall focus right now is more on that health and wellness during this pandemic. And we will have that more solidified as time goes on and we get closer to the date. What we can say now is that we do have some presenters from Partners Healthcare. We were originally going to host our summit at Partners Healthcare. They've been great with us over the last few years, letting us host at their location in Somerville. And we will have someone from there presenting. We will be working with Mima and Evan George and discussing a bit more on the emergency preparedness for persons with disabilities. And we will be working with a program called Mass for You, and also known as Optum. They're an organization within Massachusetts that focuses a lot on that wellness, mental health, and care, self-care. And we will be having a session that's kind of hosted about living with a crisis and how to better help yourself, better help others, and then how to take control of your life, working from home, working in a professional setting, going back to work, getting on public transportation. The overall presentation is more about understanding what's going on and how to better focus on you to make sure that you're healthy mentally and physically and that you're safe and able to perform your daily tasks, whether it be in a professional or personal life. So again, this is October 2nd, 2020. We will have more information to come. Before I turn that part over to Mary, I do want to touch quickly upon our August 5th virtual event. So thank you, Jeff, for doing all of this work and setting up this call. This is wonderful. We're doing something very similar for the executive branch ADA coordinators as well. So while this focuses a lot on municipalities, ADA coordinators, independent living centers, and commissions on disabilities, my call on August 5th is going to focus specifically on the 89 executive branch ADA coordinators, HR directors, managers within Massachusetts to bring a lot of the information that we're going over today and bringing a lot of the information back from our question and answer session that we have at the end of this to the ADA coordinators, to the directors, and to the managers to make sure that we're also relaying all this information to our state workers throughout Massachusetts as well. And our goal for this is bringing on the new director of the Human Resources Department, the director of the Office of Diversity and Equal Opportunity, myself, our executive director, Mary McCauley, and again, bringing back that Mass for You Optum program for the health and wellness and creating a similar agenda to make sure that we're pushing the opportunity for people to have that access to these resources throughout communities and throughout the state. And one of the things that we are working on is working with the different departments to better focus on self-identification campaigns throughout the state of Massachusetts. Our numbers now throughout Massachusetts are under 3%. We're at 2.6% of people identifying as a person with a disability throughout Massachusetts. And we know those numbers are higher, and we're working hard to try to promote those self-identification campaigns to make sure that people with disabilities throughout the state have that same equal protection, equal opportunity throughout their workplace. And we're just really trying to make sure that we have the opportunity to give those resources to everybody who needs them. So that's our August 5th event. That unfortunately is not open to the public, but we are taking the majority of the information from this today to that event and then hosting that public event for everybody. And that's a combination of everything we're doing with all of you, everything we're doing with all of the different departments in the state, combining all of that, and then bringing that to the general public on October 2nd. And with that, I'd like to turn it over to you, Mary, if there's anything else that you'd like to add before we finish this section.
Sure. Thank you, Marsh. First of all, of course, I critiqued myself and gave myself a very low grade for the introduction. I had a speech very well written and put together, and as I began to talk, I stood up and walked around my office at my house and just spoke. But I think I covered many things that I did want to say, but I also just want to add that, you know, my position as the Executive Director of Mass Office on Disability has been interesting, exciting, and challenging. You know, interesting because I have learned so much since I began with this agency, and I've realized how much more I have to learn about the entire field of disability. I mean, there's just an endless amount of information, and it's very interesting to me, and exciting because the personal, professional bandwidth that we have within this agency is vast, you know, throughout the Commonwealth of Massachusetts, and it's exciting to work with so many people, all of you that are listening and on this call, and that we can partner with, that we can collaborate with. And a major part of what I want to do as the relatively new director is to collaborate with CODs, with municipalities, you know, really do a lot together, and, you know, projects that are going to involve, you know, all our partners. I mean, we're really all partners in this field. And the position is challenging because of what I just said, because it is vast, because there's a lot of different things that we do, different services, different programs, and it just fine-tuning some of it to be able to put together strong programming, to make changes that make sense, you know, in the challenges, of course, that we're all facing every day now with COVID-19. The workforce within the Commonwealth of Massachusetts was 2% teleworking or working remotely, only 2% prior to March 10th. And at this time, it's approximately 50% of the people that work for the state of Massachusetts are working remotely. And although the administration had wanted to see that, you know, prior to the pandemic, more remote employment to reduce traffic and for a lot of other positive reasons, you know, this really was a push for that. So because of that, I think it is true that there may be possibilities for more individuals with disabilities that could work remotely. It would be a better match for them than working within a particular office. So there's some exciting things. During this tough time, there's some things to look at, and I like to look at the glasses half full. Not that this pandemic is positive in any way, but what can we learn and how can it help us as far as the way that we're planning things. But I just want to, I don't have anything else to say about the Disability Summit. I hope everyone joins us and you pass it on to others that you know. I think that we'll have a great presentation, and that one, as Moss Lynch has said, is open to the public. So, and there'll be a certain number of people. It'll probably be first come, first serve. With, I'm not sure what the number would be. It could be 300 possibly. But again, that it will be October 2nd. So save the date in your calendar. And back to you, Jeff.
Thank you, Mary. And Moss, if you can just confirm, I would assume that as soon as we get the date and the, some of the details down, there will be a dedicated website like what we've had before in previous years.
Yes, absolutely. We will be setting up the online Eventbrite so people can register, and then we will be sending out that link as we get closer to the date.
Okay, perfect. Thank you. And
Thank
thank you, Moss. Thank you, Mary. And now for the final portion of the first half of this particular presentation, I would like to introduce Tom Murphy. He's the senior attorney at the Disability Law Center. Tom, I know you wanted to talk about your upcoming year in your So can you just say hello first to make sure I actually unmuted you?
Yes, can you hear me?
Yep, take it away, Tom. Thank you.
Great, thank you, Jeff. And thanks to MOD for including us in this program. The reason why we're included today is, in addition to talking about some of the COVID-related issues, we also are engaged in our priority setting process. And so we're inviting everyone on this call to take part in that process. Just a little bit about DLC. We're a private nonprofit organization, and we are the designated protection and advocacy system for people with disabilities in Massachusetts, and that is pursuant to federal authority, statutory authority. So the authority that we have through various federal statutes began back in the 70s with giving us the ability to advocate for people with intellectual and developmental disabilities. And over the years, that's been extended to give us the right to advocate on behalf of people with mental illness, people with physical disabilities and sensory disabilities, people with traumatic brain injury, people who receive Social Security benefits, and people who require access to assistive technology, and people who require accessible voting procedures, as well as people who have representative payees. So there are various federal statutes that cover each of those various issues or types of disabilities, which again give authority to the P&A for each state. Each state and federal territory does have one. To carry out various functions in relation to advocacy for people with disabilities in the state. So our core mission includes conducting monitoring and investigations of abuse and neglect of people with disabilities in facilities and in the community, and then as well as advocacy on issues of civil rights and public access for people with disabilities, and non-discrimination in the provision of government services. So for example, currently we provide individual advocacy on issues such as employment and housing. In terms of our monitoring and investigations authority, we're similar to agencies that act as watchdogs, but where we are unique in that we are not part of the government. We are a private nonprofit organization. And in some ways our authority is broader because we are entitled to have direct, unaccompanied access to an individual with a disability who's receiving services in any type of facility setting, such as a psychiatric hospital, a residential school, a day program, a group home, or a nursing home. So we attempt to balance the work that we do, both systemically and on an individual representation basis. And we need to create a balance because we do have limited resources. And the way that we try to balance those needs is to engage in a periodic priority setting process, as I mentioned earlier. And during this process, we obtain input from stakeholders, like each of you, on the issues that are most important for DLC to be focusing on in the upcoming years. So each of you, I'm sure, is aware of issues that affect people with disabilities in your community. And you do, I'm sure, also hear directly from those individuals in terms of the issues that are affecting them. And so your opinion on what we should be focusing on in the upcoming year is very important to us. So on the screen now, you have the information regarding our priority setting survey. There is also an online forum, and you can contact us directly either through the phone number or the email address that is on the screen. I would recommend at first taking a look at the survey because I think that is really the most straightforward way to get a sense of what types of questions we're asking the community to answer at this point, and the easiest way for you to give us your feedback regarding the issues that you think we should be focusing on. So thank you, and I'll turn it back to Jeff.
And Tom, can I ask, when is that due, or when would you like the surveys? What's the deadline for the surveys?
We by the end of September, we will need to have our priorities in place and approved by our board of directors. So ideally by the end of August.
Okay, and I know we are going to be sending out another email for all of the registrants that have signed up for this training. So I will definitely include that, like this slide kind of information again for it, Tom, so it gets back out to everybody. You didn't have a brochure that you want to share that I could share with them, or is this sufficient? Like this information here for the survey?
Yeah, this is sufficient. And in addition, as you can see there, our email address is included, and our internet address is dlc-ma.org. So any additional information I think that folks would be interested in taking a look at before answering the survey would be on our website at dlc-ma.org.
Okay, perfect. So thank you, Tom, and don't mute yourself, Tom, because we're gonna start switching gears a little bit to start discussing, and I'm actually changing the slide to the slide number 4, which is question 1 of 10. And the questions that were submitted to us, this one will be fielded by Tom from DLC, but let me read the question first. The governor's executive order states that I am exempt from wearing a mask due to a disability-related condition. What happens if a retail establishment or government agency denies me entrance for not wearing a mask? Tom, if you would.
Sure. So, the order, which was issued in May, actually took a closer look at it yesterday. It's, honestly, it's actually a little ambiguous in that it speaks to places where a person is unable to maintain a distance of 6 feet, but then also says that masks are required at all times in grocery stores, pharmacies, retail stores, taxis or ride sharing, and public transportation. So I think, first of all, we need to look at kind of the issue of what is the particular setting and whether social distancing can occur. In June, there was an additional Q&A put out, which reiterates that where social distancing is not possible, so that language of whether social distancing is possible or not, which plays into the actual underlying mask requirement, is still there, and then also gives some examples, including those that were mentioned earlier. So again, I think you have to look at the particular setting to determine, is this actually a setting where social distancing is possible or very easy to achieve? Because I think in those settings, an argument can be made that mask is not an absolute requirement. And that doesn't mean that businesses might not have their own policies at this point. And so that needs to be considered as well. And I'll get into that in a minute. But the other issue is that the order itself is also clear that a mask, can be anything that covers your nose and your mouth. So different types of face coverings are possible, and there are different types that may be more tolerable for people with certain types of medical conditions, for example, depending on how tightly it fits. So I think that's also an important consideration for people with disabilities as they're going out, to take into account, their own unique particular circumstances. And then regardless of that, the order does have an exemption for anyone who's unable to wear a mask due to a medical condition. And it states that a person should not be required to produce documentation verifying the condition. So the June Q&A gives some examples, and also reiterates again that a person is not required to show proof of their condition. And I just want to take a look at some of the examples. So what they list are difficulty breathing because of a lung and respiratory condition, conditions that require supplemental oxygen, or behavioral health diagnoses that make someone unable to wear a mask. So regardless of the fact that the order does not allow to ask a person for proof of their medical condition, and I think that's sort of that makes sense in terms of other types of disability related issues where we do have some limits on whether or not someone can be required to disclose that they have a disability. Regardless of that, I do recommend that an individual who knows that they will be in a situation where they can't wear a mask in a public place should probably have a copy of the order itself. Again, not anything related to their individual disability, but a copy of the order, because there very well may be a situation where a person is asked to wear a mask and will need to say, well, it can't be required of someone who has a disability, and here's the order. I think that most businesses are aware of it, but again, having that at your disposal there on the spot is, I think, going to just sort of reinforce that a little bit. In terms of enforcement of the order, so if a person with a medical condition who can't wear a mask is ultimately denied entry, it's again a little bit ambiguous what the next steps might be for that person. The order itself only provides for enforcement by Department of Public Health and the local boards of health, with police assistance if necessary. Violation can result in a civil fine, and that the civil fine for a violation pertains to the entire order. So not just the mask requirement itself, not only that a business can be fined for allowing people who are not wearing masks, but also the fact that a person can't be excluded for not wearing a mask due to a medical condition. I mean, that is part of the order. So a civil fine could be imposed for excluding somebody who is unable to wear a mask. In terms of some sort of formal complaint, we haven't seen anything formal come out of any of the agencies that might be involved in some sort of discrimination complaint. Most likely that would be the MCAD or DOJ. But I think it would be possible to file a complaint with either of those agencies. That wouldn't be based on violation of the order itself, because again, MCAD or DOJ don't explicitly have jurisdiction to enforce this particular order. But I could see an MCAD or a DOJ complaint being filed by a person with a disability who is excluded because of an inability to wear a mask, and that would be an exclusion based on their underlying disability. So that would be similar to any other type of public accommodations type of complaint filed by a person with a disability who is denied equal access to a place of public accommodation. And that would go through the same type of process. It would require proof that the person was excluded because of their disability, which requires proof of an underlying disability. So not just any medical condition, but an actual disability under the ADA. And that would also be subject to the defenses that are available to an ADA complaint or a Massachusetts Public Accommodation Statute complaint. And that would include direct threat. So a business would potentially at least be able to argue that even despite the fact that the person couldn't wear a mask because of a disability, allowing them entry to the place of public accommodation would have posed a direct threat to the general public. And again, that's going to be a very, very fact-specific inquiry, including what type of place of public accommodation are we talking about, and would social distancing actually have been possible? Those are things that are going to directly impact whether or not a business would be able to establish a direct threat defense. So again, we don't have anything yet out of the MCAD in terms of a decision. As most people on this call probably know, they work very slowly. I don't know if any complaints have actually even been filed with them. But because this is so unprecedented, we don't have anything direct to point to. But either way, these types of cases, should they get to that point, are going to be very, very fact specific in terms of what type of disability a person has, why they're unable to wear a mask, and what type of social distancing might have been possible if they were allowed participation or entry without a mask. And then the last thing I want to say about that is that the AG's office, again, while not sort of directly enforcing the order, they are fielding a lot of calls from folks about the mask order and people with disabilities who are unable to wear a mask. And I know that they have, at least on some occasions, sent out letters to businesses. So reminding them of their obligations with respect to people with disabilities under the order. And so that's another avenue of resource for folks.
All right. Tom, thank you very much. And again, don't mute yourself because I think you're coming up again relatively quickly. I would switch over to question 2. And again, some of these resources that we've been discussing and links are being shared in chat right now, but we will also be sharing an after event email with some of these additional resources specific to what we've had here today. So let's move on to question 2. And again, this question here is for you, Tom, as well. And let me just read this one out. My local barber shop only lets one person in at a time. I do not have a car to wait in and cannot stand outside for a long period of time. What are my rights? Tom, you're up.
So, so the general rule under Title III of the ADA is that modifications to policies and reasonable accommodations need to be provided to people with disabilities to ensure that they have equal access to the goods and services of the place of public accommodation. So, classic example of that is a service animal. Business might have a no pets policy. That is a policy of the business, and it does need to be modified for a person with a disability who has a need for a service animal in order to give them equal access. So similarly, if we're talking about a situation where the barbershop might only be letting in one person at a time, obviously due to the, wanting to limit the number of people in the place of business and allow for social distancing, that's a policy, just like a no pets policy. That's their rule. And so a person with a disability has the right to ask for a modification of that policy. I would think that here, and there really is no limit, to what can be kind of an accommodation or a modification. There might be legal limits in terms of what a business is ultimately required to do, but there aren't any limits in terms of thinking outside the box of a possible solution that would not amount to some sort of undue burden or fundamental alteration on the business. So here, I can think of a number of different ways where this particular policy could be modified so that a person with a disability has an equal right of access. Very simply, the business could provide the person with a chair, put it in a sheltered area, so they're not just sort of sitting out in the sun, somewhere where they're going to be safe and they're going to be comfortable. Or they could provide someone with a specific appointment time. Again, just because the business is saying you have to queue up and come in one at a time, doesn't mean that as a reasonable accommodation for a person with a disability, they're completely precluded from modifying that policy. Again, if there's a specific disability related need for it, for a person, and actually giving them a time, an appointment time. So, I think similar to the mask issue in the first question, I really think that the most important thing for people with disabilities in these situations that are occurring now is to really try to be proactive. And by that, I mean, call ahead. You're going to a business, either in this instance that you may be required to wait online, which is going to be difficult for you, or if it's a mask issue, if you know that that's something that you're going to need a modification, call ahead and discuss the issue either with the business owner. Again, if this is a local barber shop, you're probably talking about just the barber, him or herself, the business owner. But even if it's like a big chain store, call ahead, try to talk to the manager, explain, what the situation is. I think that for the most part, when we're talking about larger businesses, the managers are going to be much more aware of what the obligations are. And the frontline people, chances are there's a better chance that they're not. I mean, hopefully the people that are waiting outside of Stop and Shop, to enforce the numbers requirements or the mask requirement or whatever it is, again, those aren't going to be managers. Those are going to be lower level frontline employees. Hopefully they're being trained on what these laws and orders are saying, but they may not be, or they may not be as adept at handling the situation as someone who has, achieved the level of manager. And I think that if someone could, again, proactively speak to a manager or someone else who is in charge and explain the situation, it's more likely that they'll be able to, have a plan in place rather than just kind of showing up and hoping that the person who is at the front door is going to know, what should occur in that particular situation. And again, the added benefit of that too is that if you do call ahead and encounter resistance, then there's more of a chance that a solution could be worked out, even if that includes, again, making a call to the AG's office in advance so that maybe they would send a letter or contact the business. Because if the solution, if a solution can be worked out in advance, obviously that's going to give the person the ability to actually participate, enter the store or whatever the situation is. Whereas if the problem doesn't occur for the first time until the person is actually there, it's very unlikely that a solution is going to be resolved, right on the spot. So I think being proactive really is an important consideration in these times.
All right, thank you, Tom.
And Jeff, I'd actually like to add to that. Thank you very much, Tom. I just wanted to add, as far as the modifications, realize completely if it's like a no animal policy or something, that'd have to always be a modification because a service animal would be allowed, but and no pets would really be a kind of a separate category since service animals are not pets. You could say no pets are allowed, but then also there's always service animals allowed because they wouldn't come under that category as well. I just wanted to add that. And one other thing, I actually, and this is Mary McCauley, for anyone that doesn't recognize my voice. I actually went to the hairdressers one day after they were open, and the salon was in a mall. And, you know, I would have been able to call the manager, and I think they would have put a chair out for me. I did not do that, and I'm, you know, in some circumstances I may have done that, but I did not have to do it the way I did it, but I actually have a camping chair that I threw over my shoulder, and it's pretty lightweight, and I had taken the ride, and I knew the ride, the way I scheduled it, the ride was going to get me there early, and I couldn't get into this mall at all, so I'd be sitting outside. So I just opened my camping chair and sat on it, and when they came and got me, I folded it up, threw it over my shoulder again, and went up to the hairdressers. I had again wait outside in a hallway where there were no chairs. So I opened up the camping chair again and sat on it, and you know, and that worked. You know, did I have to do that? No. Could I have called and asked them to provide me with the chair? Absolutely. And I, you know, and I believe they would, and that would have also worked. But, you know, that's just the way I chose to do it, and that worked out okay for me. So I like to add when there's always different ways to handle things. That's all.
All right. I want to thank you again for Tom and Mary for those comments. We are now going to shift to the third question from slide 6, which is question 3 of 10. And this third question will be going to Naomi Goldberg, MOD's Assistant Director for the Disability Rights Unit. I'm just going to read the question first, and Naomi, I'll turn it over to you. So the question that we received was, to whom do I complain if a business is not enforcing the requirements for customers to wear masks? And Naomi, over to you.
Okay. Well, there are two options. You can contact your local Board of Health, and you could also contact the Department of Labor Standards. And actually, this information is on the mass.gov website, and I haven't looked at the resource stuff at the bottom to know whether the link is there. But if you do contact the Department of Labor Standards, it looks like they do an investigation. You know, they'll contact you within 72 hours if an investigation is conducted. Those are the two options, and I think the same can be said with the local Board of Health, that someone could go to the local Board of Health to complain about being turned away from a business as well. And that's one of the things that MOD has been working on the past few months to try to connect with the department within the Department of Public Health that deals with the local boards of health to see if this is, you know, a messaging issue. I mean, it seems to be a messaging issue to put messages out to businesses about what the requirements are. I realize that was not this question, and this is about people who are concerned that businesses aren't complying. So those are the two options, and we can obviously put up the link on mass.gov website that tells you exactly how to complain.
Okay, and we will be again adding that to the after meeting email. So we will make sure we get that out to you, at least a more direct link rather than having to navigate through mass.gov COVID specific links that we provided on the resource page. So with that, I'm going to move on to question 4 of 10, which is page 7 of your slide deck. In the fourth question that we received, let me just make sure, and Tom, you're going to be fielding this one. I just want to first make sure you are muted so you can get to it when I finish reading the question. So here's the question. The question is, I have a condition listed by the CDC as being vulnerable to COVID-19. My employer wants me to return to work, but I don't think I can do so safely. What are my rights, and do I have to return to work? Tom, over to you.
Thanks, Jeff. I feel like a reporter out in the field.
Me too. I won't ask you about the weather. So.
Yeah, it's actually pretty nice out where I am. I think the first thing that employees should do is look to whether or not you might have any benefits coming to you in terms of sick leave, paid sick leave. That could be just directly through your employer, depending on who you work for, if you're unionized. There's also the Families First Coronavirus Response Act, which was passed a couple of months ago, that allows for paid leave for certain individuals. So FMLA is another option. Now these are going to be limited to most likely someone who actually has a diagnosis of COVID or symptoms related to COVID-19, because these are allow for leave for people who can't work because of a specific medical condition. In terms of someone who is being required to return to work, but isn't sure that they can do so safely, if you are a person with a disability, then under Title I of the ADA or Chapter 151B here in Massachusetts, you would need to establish in the first instance that you do actually have a disability under one of those statutes, and it's very similar in terms of doing that. You have to have a physical or a mental impairment which substantially limits one or more major life activities. So, for example, in current circumstances, someone with asthma who may have concerns about returning to work because they may be more vulnerable to having being diagnosed with COVID-19 and having the symptoms affect them in a much more dramatic way. The person does have to establish that not only that they have asthma, but that they do have a substantial limitation on the major life activities such as breathing. So it's important to remember that reasonable accommodations are solely for people who actually have disabilities, or can establish that they have a disability under one of those statutes that apply. Assuming that a person has a disability which meets the definition under the ADA or under state law, then they're entitled to a reasonable accommodation. Now, what might that look like in these circumstances? Again, this is unprecedented, so we don't have a lot to point to specifically other than case law involving reasonable accommodations generally in the past, as well as some guidances that have been put out. And the most important one is an EEOC publication, which you can find online. It's called What You Should Know About COVID-19 and the ADA. And in this, the EEOC answers some of the questions that are being posed now in terms of employment and what that might mean for people with disabilities in the workforce. And another good resource that people I think should look at is the Job Accommodations Network, which also now has some specific COVID-related guidances that are on their website, and really, I think, are good resources to give folks an idea of what types of accommodations they might be entitled to. Now, keep in mind, these are guidelines only. So ultimately, the question of what is required in any particular circumstance really just comes down to a court. And that analysis is going to be very fact specific. But in terms of what the EEOC has said, just a few points that I want to stress. They do make it clear that the ADA applies regardless of a state of emergency. But given the state of emergency, the ADA does need to be balanced with the need for employers to follow guidances that have been put out by the CDC and by state and local boards of health in terms of keeping workplaces safe and healthy and ensuring that someone who might be symptomatic or might pose a threat to other people in the workplace are not allowed to return. So specifically, the EEOC has said that employers are allowed to have employees stay at home if they're ill or if they have symptoms of COVID-19. But on the flip side, the EEOC has also made it clear that reasonable accommodations are necessary. So any change that would allow a person to perform the essential functions of their job could be considered a reasonable accommodation. And in terms of how that might affect workplaces now, I think the important thing to look at is where are the essential functions of the job being conducted. Either, just to use two extreme examples, you could have someone who solely works in an office and sits at a computer all day and does all of their work in that type of setting, or someone who works in a retail store. Now, obviously, someone who works in a store can't perform the essential functions of their job at home. Someone who works in an office much more likely could. And so that needs to be the first analysis, is where are the essential functions being conducted? If a job can only be conducted at a particular workplace, like in a store or some sort of construction job or something like that, then employers still need to look at whether there are accommodations that are available that would allow an employee to do their job and stay safe, even if they have an underlying medical condition which might make them more vulnerable to COVID-19. So that includes things that CDC has already said should be happening in any workplace, like social distancing, use of PPEs, frequent cleaning, things like that. Getting beyond those more sort of physical issues, specifically as accommodations, employers should be looking at whether somebody's workspace could be changed so that maybe they may physically be present but have less contact with other people in the workplace. So temporarily moving where somebody does their job, temporarily changing some of their work functions, maybe not the essential work functions that they have, but some of the more sort of peripheral functions, or possibly modifying somebody's schedule so that, again, maybe they're working a shift where they're going to have less interaction with other people, and they're therefore being less often potentially exposed. On the other side, if work can be performed remotely, then the EEOC has said that this does need to be considered as a reasonable accommodation. Even if employers are saying we want everyone back in the workplace now that businesses are reopening, if a person can do their job remotely, employers do need to consider that as a reasonable accommodation. And that will go through the same type of analysis as any other type of accommodation. Is it reasonable? Is there an alternative possible that an employer might propose that would also give the person the ability to do their job, but in the workplace, like some of the things we talked about earlier? Or might that continuing to work from home pose some sort of undue hardship on the employer in terms of supervisory responsibilities and abilities and things like that? Now, the answers to some of those questions will be affected in some ways by the fact that most people have been working from home for a significant period of time. But again, employers will be able to go through the same type of analysis during the interactive process to determine whether a request to continue working from home is reasonable or not, or whether it might pose an undue hardship. As a last resort, if a person cannot work in the workplace and cannot perform their job at home, then employers, as reasonable accommodations, should consider whether the person can be transferred to a different type of job that they're qualified for, that they could either perform at home or in the workplace in some sort of modified way, or a temporary leave of absence. Again, as a last resort, a leave of absence for an employee who can no longer perform the job that they have, but who at some point in the future most likely will be able to perform the job. That might be considered a reasonable accommodation to give them a short leave of absence, not indefinite, but obviously, we're all hoping that at some point things are going to return back to normal, and most likely a person with a disability who can't do their job right now will be able to do that in the workplace at some point, hopefully relatively soon. So again, usually as a last resort, but a leave of absence could be considered a form of reasonable accommodation as well.
All right. And Tom, thank you again. I do want to oh, yes, Mary?
I'm sorry. Could I just add one thing to that as well?
Sure thing. I just want to remind everybody we are at the half hour to closure time, so, but feel free to make a mention, Mary, go for it.
Okay, it will be brief. I just wanted to say that was a fabulous overview of reasonable accommodations and ADA with, COVID in mind, and that I happen to be on a workforce committee, a subcommittee for inclusion and diversity, and within that committee, this relates to Commonwealth of Massachusetts employees. We are also discussing this would not be under ADA, this is not with people with disabilities, but with an individual that may have a compromised immune system or may be at a higher risk to get COVID for various reasons, maybe 65 years or older, may live with someone that's seriously compromised. Then in those cases, we're calling it an adjustment, not an accommodation, but they may be able to request adjustments at work. That would not be within the law like the ADA, but we're looking at it within the Commonwealth of Mass as far as working with people to be able to offer possibilities to get more people working, even if they maybe can't come in the office, or there's other ways that they can do their job that are going to work for the state. So just wanted to mention that. Thank you, Jeff.
Thank you, Mary. Moving on to the fifth question that was submitted to us, so question 5 of 10 on slide 8. Again, this one is for you, Tom. I know we're working you out early in the morning here, but the next question reads, what is an employer's obligation to provide the same technologies and accessible equipment that I have in the office at my home when I am teleworking?
Thanks, Jeff. And I'll go through this one a little bit more quickly because I think we've covered a lot of the major points here. So again, we're talking about reasonable accommodation, and that applies regardless of where a person is performing their job. So if your employer says you need to do your job here in the office, they need to provide you with accommodations. If they say we're having everyone work remotely at home, they still need to provide you with reasonable accommodations. And that means that they need to give you the equipment, the changes, whatever necessary to allow you to perform the essential functions of your job. I think it's important for people with disabilities, first and foremost, to not assume that your employer knows what you need. You still have to make the request. Even if you've had accommodations in place in the workplace for years and now suddenly you're working from home, don't just assume that your employer is going to ensure that you have what you need while you're working from home. It's incumbent on you as the employee with the disability to make the request. I always recommend that people do that in writing so that there's a paper trail, and to engage in the interactive process with their employer. I mean, that really is the key to reasonable accommodation. So, and it's an obligation on both parties, both the employer and the employee, to engage in that interactive process in good faith to determine an accommodation that's going to work both for the employee and for the employer. And so, the obligation is still essentially the same to provide accommodations, but like any other type of reasonable accommodation request, employers do have the undue hardship sort of defense available to them, and that could be affected. The EEOC makes reference in their publication to the fact that if somebody's working from home, there could be issues in terms of supply chain, things that are just a little bit more difficult to achieve for an employer to provide in someone's home versus in the office. And those are things that need to be considered as well, and should be part of the discussion during the interactive process. Employees need to keep in mind that they may need to provide medical documentation to show that they have a disability and or a disability related need for the accommodation. And again, as part of that interactive process, should really consider what alternatives there might be. So, an employee is never absolutely entitled to the first type of accommodation they ask for. There may need to be some adjustments made to what it's going to look like. And in terms of someone working from home, I think an employer, will have the right to, ask what types of equipment or things the person has at their disposal already at their home in terms of their ability to perform their job, so that an employer can determine whether it is actually necessary for them to provide the accommodation. And the last point I wanted to make about this in terms of working from home is that there is not a requirement that an employer provide any sort of equipment or technology for the employee to keep. All right, so like any other type of accommodation that's provided in the workplace, the ultimate sort of ownership of whatever that is, if it's a piece of equipment especially, is for the employer. And so, an employer may be required to provide sort of a temporary piece of equipment or something like that for someone who's working from home. But that would not be something that they would be required to purchase for the person to keep for their own personal use.
All right, thank you, Tom. Now, Chikira, I just want to make sure that I've unmuted you appropriately.
Hi, good morning.
Good morning. Okay, so thank you, Tom, really again. The next question that came in will be for Chikira Rogers, who's MOD's accessibility specialist. The question reads, if accessible parking is provided on street and is removed, while other non-accessible on-street parking remains, what obligations does the town have to replace the accessible on-street parking spaces? And Chikira, I will turn that over to you.
Perfect. Thank you, Jeff, for that introduction. So the requirements for on-street parking spaces versus off-street parking lots differ substantially. While the Americans with Disabilities Act design standards and the Massachusetts Architectural Access Board's rules and regulations have jurisdiction over off-street parking lots, we must look to on-street parking spaces programmatically, since both the Americans with Disabilities Act design standards and the Massachusetts Architectural Access Board's rules and regulations do not currently have jurisdiction over on-street parking. To determine programmatic obligations, we must turn to the Americans with Disabilities Act itself to review the issue from the Title II obligations of the provision of programmatic access. I would also like to note that MGL Chapter 40, Section 22A also has language discussing this. Since we are unable to turn to the Massachusetts Architectural Access Board rules and regulations or the Americans with Disabilities Act design standards for the technical requirements, we must look at the overarching obligations of a Title II entity covered under the Americans with Disabilities Act. Title II of the Americans with Disabilities Act covers state and local government and requires that covered entities ensure that their programs and services are accessible to and usable by persons with disabilities. On-street parking is a service offered to everyone. Therefore, it must be ensured that accessible on-street parking is also provided. Currently, as a general rule of thumb, a minimum of 5% of the on-street parking should be accessible. So in short, yes, if on-street accessible parking is being removed for any reason, relocating those spaces to the closest alternative space with an equal level of accessibility than what was previously provided would meet the intent of the Title II programmatic access responsibilities. In addition to the ADA Title II obligations, state law also has a provision for accessible on-street parking spaces as well, which should assist in the supporting remediation. I also want to highlight what is currently best practice for municipalities when looking to comply with Title II obligations for the public rights of way. The United States Access Board has developed guidelines for the public rights of way, known as PROAG, that looks to address various issues, including access for persons with low or limited vision at street crossings, access to on-street parking, and various constraints posed by space limitations, roadway design practices, slope, and terrain. The new guidelines will provide technical requirements that cover pedestrian access to sidewalks and streets, including crosswalks, curb ramps, street furnishings, accessible pedestrian signals, parking, and other components of public rights of way. The board's aim in developing these guidelines is to ensure that access for persons with disabilities is provided wherever a pedestrian way is newly built or altered, and that the same degree of convenience, connection, and safety are provided to pedestrians with disabilities. Although these guidelines have been promulgated, it is on other entities to adopt and use these standards. For example, while Federal Highway is incorporating a significant portion, if not all, of PROAG into their projects, this would only cover projects using specific monies and also projects tied to Federal Highway. However, once these guidelines are adopted by the Department of Justice, they will become an enforceable standard under Title II of the Americans with Disabilities Act, similarly to the Americans with Disabilities Act design standards. While accessible on-street parking would be considered a Title II obligation under the Americans with Disabilities Act, and a complaint to the Department of Justice may be appropriate, beginning these discussions with the locality or entity who has jurisdiction over the street, such as the Americans with Disabilities Act coordinator, should be part of the process to work locally to remedy the concerns. This is why I frequently suggest raising the concern with the local ADA coordinator to assist with recourse, often done through an interactive process or by filing a Title II grievance. Municipalities with over 50 employees must have a grievance procedure on file, and this grievance procedure must be easily found either on the municipality's website or posted at a municipal office, such as a town hall. If a Title II ADA grievance is filed with the municipality, this may allow for the issue to be resolved locally within specified timeframes and a formalized process to follow, including appeals. The other options are not so locally available, as they result in a Title II complaint with the United States Department of Justice or through private lawsuits. Resolutions are often achieved through an interactive process between the local ADA coordinator and the person aggrieved. A successful resolution based on the grievance may resolve the issue in its entirety and may not make the Title II DOJ complaint necessary. If you have any questions related to the process or would like specific details on various design, obligations, enforcement avenues, and other considerations, please contact us directly. Thank you. Back to you, Jeff.
All right, thank you, Jakira. And I do want to kind of just bring this particular question, which has, we're seeing a lot of parking spaces in streets and other areas being taken over for the outdoor dining scenarios. So this is really playing out a pretty big part right now across the Commonwealth. So I will also be sharing with you a newly finished fact sheet for outdoor dining and seating. The fact sheet related to this, what's happening because of COVID in parking, is definitely one of those conversation pieces. Again, that will be shared after the event in that email. It will have some additional items there as well. So so thank you, Jakira. Now I'm going to move on to question 7 of 10. And this one is for Naomi Goldberg. Let me just read the question quickly, and then Naomi, I'll turn it over to you. So the question reads, I am a town meeting member. What is my town's obligation to accommodate my need for remote participation?
Okay, thanks. So municipalities do have an obligation to ensure that town meeting members with disabilities can equally participate in the meeting, can communicate effectively, etc. During a pandemic, a municipality would obviously need to take into account how members who are vulnerable can participate safely and mitigate direct threat concerns. If a town meeting member did request to participate remotely as a reasonable accommodation due to their medical condition and their safety concerns, the municipality would use the same analysis as they would for any other kind of request for reasonable accommodation. They would be looking at the specific facts and determining whether granting the accommodation is possible. Would it result in a fundamental alteration to the program? And also be looking at whether there's an equally effective solution that they could provide if they can't do this. So I think at MOD, we really can't speak to the barriers that may exist in the structure of particular town meetings. But I assume that there are various logistical concerns around participating remotely and voting remotely, and whether or not and I'm not sure if this question was just about everyone participating remotely or just portions or someone requesting it as an accommodation. But whether or not it could be done for one person is something that, they would look at case by case. And if a town meeting member said that they couldn't participate, maybe they would look at whether there are other social distancing options. Could there be a separate room where someone could sit, could they create different scenarios that would allow someone to participate if in fact there was some barrier to offering this as a remote option. And, the particulars of the situation is going to dictate how it's analyzed, including what specific barriers exist, for that member, why they're asking for it. What do the bylaws say? Is it possible to modify them at all? What kind of technology exists? But, I think a good takeaway from this is, as commission members and ADA coordinators, it's probably a great time or an opportune time to look at this issue, how to plan for it in the future. We don't know what's going to happen next year, but just in general, is there a need for this? What technologies would need to be in place if that's one of the barriers? What's the capacity of their current technology? So, I think, this isn't an exact answer to this question, but these are some of the factors that one would look at. Thanks.
All right, thank you, Naomi. And I know in Massachusetts, you're a town meeting community. You're right. You have your own bylaws, and that could potentially require changes to your bylaws to ensure that these changes could be implemented, and there's a whole process for that. So while we can't get down to the nitty-gritty of it, Naomi, thank you for the general answer, and I thank you for that. We will now move on to question 8, and Evan George, our Emergency Preparedness Training Coordinator, will be fielding this one. It's a lengthy question, so let me just quickly read it, and then we'll go on. And so last month, a local commission on disability invited the Fire Chief and the Council on Aging Advisory Council Chairperson to discuss emergency preparedness in disastrous storms, such as hurricanes, during the COVID-19 pandemic. They ensured the commission that they have emergency plans to assist people with disabilities, as well as senior citizens. However, the Fire Chief would like additional information on how to help them. Does MOD have updated emergency plans that I could share with the Fire Chief and other town officials? And Evan, over to you.
All right, fantastic question. Being very cognizant of the time, the first thing that I want to address is just about how emergency plans are conducted. In reality, there are 351 cities and towns across the Commonwealth, and each one has 2 things in common. They have a local emergency manager, who in this community might very well be the fire chief. And the second is they have a local emergency plan. Something that Mima was very cognizant of is that basically all 351 plans will now have to change, especially because this is, actually this week is Hurricane Preparedness Week. And because generally for a hurricane, we would tell everyone to open up what's called a congregate shelter, put everyone inside of a gymnasium, put some cots out. However, as I'm sure you're all aware, that is incredibly difficult and concerning to do during a pandemic where we want people to stay separate. So to directly answer this question, MOD was also part of a guidance group over the last few months to create I believe it's a 60 to 70 page document, specifically guidance for mass care operations, think of shelters, during a pandemic. Now, this document is in the very final stages of being released publicly. I think it's just right now going through some of the higher ups at Mema along with the legal department. And what's great about our document, and it's being used as a template really across the nation, is that rather than pushing all access and functional needs to an appendix or to like an ending document, what we have done is interwoven all access and functional needs, considerations, accommodations throughout the document itself. So that if the local emergency manager sees something that says all people must be screened and asked to wear a protective mask, right underneath that, it'll also make sure that the fire chief, the local emergency manager, is aware that for some individuals, because of their medical conditions, are unable to do this. And then we give them some ideas about alternative accommodations to keep everyone safe. And so to access this document, again, it is, I believe, in the very final stages of being released. If you would like to reach out to Mima directly to ask if the guidance for mass care operations during the pandemic document is available, they'll be able to give it to you. If you are running into a roadblock, please, again, don't hesitate to reach out to me. And once I know that that document is finalized and made public, I will be happy to share it with all of you. And Jeff, back to you.
All right, thank you, Evan. We are starting to wind down, so we have 2 more questions to go through. And I am seeing a lot of things being asked in chat, so I know we're not going to be answering them directly here on this particular call. We will be answering appropriately back to either generalized or back to the individual specifically. So thank you for keeping some of those questions in chat. So with that, let me move on to question 9 of 10, which is actually for me. So let me start by reading the question. And I want to thank you, Evan, for your overview of that, and I appreciate that. So for question 9 out of 10, so the question was, building inspectors cannot enforce the ADA design standards on the local level, like they do for the Massachusetts Architectural Access Board and other Massachusetts codes that they have authority to enforce. While the Department of Justice can address complaints, what is the local mechanism, if any, for settling ADA disputes with public accommodations, which are Title III entities, in the realm of communication access and physical access? So it was a great question submitted. So in short, both Title III of the ADA and the Massachusetts Public Accommodation Law prohibit discrimination in places of public accommodation. They are enforced by, as you've probably heard a couple times, by the Department of Justice and the Mass Commission Against Discrimination, respectively. To really dive into this question, I would like to divide this question into 2 parts. First one being effective communication, and we'll finish up with architectural accessibility. Effective communication is when there's a barrier to communication access, or there is a need for a modification of a policy so that persons with a disability can participate. The first step to addressing that need would be to notify the entity that there's a disability-related barrier and to inform them of what needs to be in place in order to participate. The person should be sure to explain the connection between the limitations, or their limitations, and what it is that they are requesting. While it's not required under either law to put such a request in writing, if needed, doing so creates a record that a request has in fact been made and that there's an expectation that the request will be evaluated, and at the end of the day that there's an expectation that a response and resolution will be provided. Effective communication is required regardless of whether you're state or local government or public accommodation. So when we talk about Title II and Title III, it's referencing to the ADA, but Title II falls to state and local government, while Title III falls to public accommodations. However, the provisions of how that is provided is a little bit different depending on what title the entity falls under. So Title II entities have a stronger obligation to provide a person making the request their preferred options, while Title III entities have a slightly lesser level of compliance, but still need to ensure what communication provisions are provided, as long as they are effective. So while the intent is to ensure that communication with individuals with disabilities is equally effective as communication with people without disabilities, Title III of the ADA does not require the interactive process with the person requesting that accommodation. However, It is important to consider what method of communication may be best for the type of goods or services being provided to anticipate customer needs. For example, if someone requests a Braille menu at a restaurant, the restaurant's a Title III entity under the Americans with Disabilities Act, the restaurant can look to see if there's another method of ensuring effective communication that could be made, such as, as an audio recording or an MP3 or a server reading the menu options to the individual. Would that be effective? If communication is not provided effectively, the recourse or liability is that someone could file a discrimination complaint at either the Mass Commission Against Discrimination or with the Department of Justice. While DOJ is an appropriate avenue for this type of complaint, I just want to note that DOJ does not always investigate every complaint that they receive, or they don't investigate every complaint that they receive. So really articulating your need with the entity, and as the entity, anticipating the needs of all the customers is really a critical piece to this. Another consideration would be to work with the local commissions on disabilities to educate businesses of their obligations and provide technical assistance to those businesses. There are still tax credits available for businesses who incur expenses related to ADA communication efforts. And the fact sheet, again, will be shared after this event that I will share with you. But I wanted to highlight that avenue for promoting voluntary compliance efforts that can be had with your local commission on disabilities or your local independent living center. Shifting gears a little bit to architectural accessibility for this same setting where who can enforce the ADA design standards on the local level. While the Department of Justice is the enforcement entity for ADA and the ADA design standards, and it resides on the federal level, unfortunately, there really is no alternative enforcement mechanism provided on the local level. While for Title II entities, there are some local actions that can be taken to resolve these types of issues, like filing a Title II grievance with the municipality and or engaging in the interactive process with your local ADA coordinator for avenues of remediation. There is not a simple process provided when we discuss Title III entities. Most physical barriers for Title III entities will require, for enforcement, a Title III complaint directly with the Department of Justice. If the architectural barrier is not enforceable by the local building inspector, what that really means in our world is that there isn't a connection or tie to the state's Massachusetts Architectural Access Board rules and regulations. Enforcement really can only be sought by filing a Title III ADA complaint with the Department of Justice. And again, in our resources, there's a link to the ADA homepage, which on top of many other resources, there is also an avenue for a complaint if that is warranted. I cannot stress enough working with the local commission or as a commission on disabilities doing proactive work with local businesses, especially during this time and as things are shifting and moving and things are changing up. I think that can be very strong and be in conjunction with the tax incentives for small businesses. This could be a really good icebreaker to make that introduction and dialogue and at the end of the day, hopefully remedies. Now, with that, we are going to move on to the final question and just going to make sure, Jakira, are you unmuted?
Yes, I am unmuted. Thank you.
Okay. And so to conclude this presentation, and we will have a little bit of closeout after Jakira has gone through this, I want to turn this over to Jakira Rogers for the final discussion. Jakira?
Thank you, Jeff. So to conclude this presentation, we are hoping to use this space to address an important issue. Due to the most current social justice movement, MOD wants to use this opportunity to bridge the gap between race and disability. We would like to pose a few questions in hopes of receiving responses after this meeting. Have other commissions and/or organizations reached out to collaborate? Have you reached out to other commissions and/or local organizations to have a collaborative discussion regarding race and its impact to other marginalized populations? If you would like to share your experience and/or recent initiatives with the group, please email mod-info@mass.gov no later than Monday, July 27th to share your recent efforts and/or collaborations. The following Monday, we will send out an email to all attendees capturing responses. Thank you.
All right, thank you, Jakira. So as we start to and as we begin to end this meeting, I wanted to go over a couple of the additional slides. We have 2 resource slides. And again, this doesn't even, I'll be honest, it probably doesn't crack the surface If you are lucky enough to be on any of the Independent Living Center's newsletters or the New England ADA newsletters, you will see a lot of additional resources that are being provided on a frequent basis. So I cannot stress enough to connect with your local Independent Living Center as well as other organizations that we've got listed here. Most of the items listed here, if they have a direct web page for COVID-19 related topics, I have provided the direct link there. So for example, the Department of Public Health link isn't just to DPH's homepage, it's actually to their COVID-19 page. And again, that is similar for most of these. So a lot of the items we've talked about, for example, the reopening information on mass.gov, there's a direct link here. There is also for Mima, Mima's link is here. We've got some of these other resources. If you're curious which independent living center that is servicing your community, we have a direct link to find a center. You just enter the town's name or the community's name, and it will tell you which independent living center serves your area. I also wanted to point out that I know the EEOC was mentioned a couple times, and here's a link to the coronavirus page that I believe was being mentioned. There was a wealth of information there. We also, on the second resource slide, which is what I am on now on page 15, I wanted to just clearly call out that here's the link to the ADA grant program that we offer, which will be updated shortly, and we'll be catching up to that. I also wanted to point out the personal emergency preparedness training. So if this is something you would like to bring to your community, this is where you can find some of that information. And Evan George can help with that, and he gave you his contact info. We do have a Commission on Disability resource page, which is linked here as the mass.gov/MODCOD/COD. And we also provided some real base information, common information for municipal ADA coordinators. Here, I'm sorry, I was just making sure people were able to hear me. We have the Title II Action Guide, which is one of the best tools I've been able to find that can really help a community get their administrative requirements under the ADA in check. It's a really great tool. I also want to point out the ADA checklist here, which is an easy to use tool that will help you evaluate architectural elements for compliance under the ADA. And to close out, and as we close this meeting, please reach out to us with any questions you may have. I said, as I had mentioned, we will be sending a couple of emails to all participants relatively soon with some additional resources that we have put together. Again, I want to thank the Disability Law Center for their partnership in this meeting. To everyone who helped present and put together this meeting, I want to thank the ASL and CART reporters for being part of this meeting. And most of all to you, the audience, thank you for attending this. With that, this meeting will officially end. So thank you so much, and we look forward to having more of these in the future. Thank you.